Right now we return to 3 parallel sessions, each dedicated to crucial and very timely question: how do we define success in health innovation and how we can measure it effectively? And once again, we will have the same moderators, so my speech will be a little bit shorter than previously. So please, healthcare in here, welcome Guldemond once again, please join me. The biopharma, Magdalena Chlebus, once again, thank you for being with us with this previous session and good luck with the next one. And exactly, we wish the same to MedTech and Digital Health session. Greetings for Montse Daban. This is the third space. And please welcome panelists in each room. Thank you so much.
Come down, take a seat, panelist. It's Martine Pergent, Natalia Haraszkiewicz, yeah, and Igna Lipska, and I think we have also Kośla again. So we have 4 panelists. Welcome, please. A warm welcome. Yes, so in the last session we discussed a little bit on how to overcome barriers towards more progress in EU life sciences. And also this morning, the US was mentioned, where a lot of high-quality research and innovation is done, a lot of funding and investments available for companies, for universities, hopefully also for the future. But if you look to healthcare systems, actually the US is performing really, really bad. From the development, from the developed countries. The US is the most expensive healthcare system in the world. The outcomes are really bad, far below what we are performing in Europe. And about 50% of US citizens don't have even access to the most basic healthcare, like a family doctor. Let alone innovative treatments. So there is something, if we look to innovation, especially in healthcare, how it eventually translates into solutions for people. And that's also sometimes where I try to get my head around on if we do wonderful on this or that or maybe less, how does it relate to practice? So I hope we can reflect a little bit in this panel. So before we go into the questions, I would kindly ask to tell something about yourself, about your organization, your role. So can I start with the left-hand side, please?
Sure, thank you. Thank you very much. I'm very happy to be here, especially I will be in Warsaw next week, so I will be able to compare. And I'm sure that, well, for what I've seen. Anyway, I am representing the Transform Alliance, which is a consortium of the stakeholders, the researchers, the clinicians, the patient groups, and the industry. So it's really about collaboration, and this allows us to procure some policy pieces where we have asks and also solutions that we want to provide. And our mission is really to allow a timely access and a sustainable access to medicine and especially ATMPs, advanced therapies. In addition to that, I'm the president of IPOPI, the International Patient Organization for Primary Immune Deficiency, a range of 550 different conditions, rare conditions, so I have also the rare angle in my daily life, I would say.
Merci beaucoup, Martine. Okay, Kośla, please.
Malgorzata Kośla, Baxter Research Foundation is this patient-led research initiative, also international and interdisciplinary.
Natalia Haraszkiewicz-Birkmeier. I have over 20 years of experience within public and private healthcare systems and innovation ecosystems. 4 years ago, I assumed my role to be a scientific advisor for the European Commission. And since then, I have been involved in various legislative and non-legislative instruments and initiatives. For example, the Health Technology Assessment Regulation, the Startup and Scale-Up Strategy, the Critical Medicines Act, and recently also the Life Science Strategy for the European Union.
Thank you very much, Natalia.
Monika, Ślęzak. I am the coordinator of the Industry Contact Point MedTech and Health. We are located in Warsaw in Wrocław, at the Lukasiewicz Research Network Polish Center for Technology Development. And I'm here since, like Port itself has in its core activities life science. This is one development and also interaction with patients, what was mentioned today several times. We would like to try to find this direct way to the patients, that the life science innovations really find their solutions directly at the patient side. And as a coordinator of the industry contact points, we were involved in preparation of one of the workshops preparing for this event, asking the European projects about their key factors, but also bottlenecks regarding the synergies between European projects and how can we change it, also with the life science strategy, to make this healthcare more accessible and equitable to all European patients.
Thank you so much. And that's basically the key question which I would like to ask. So that is what can we learn if we look back from looking at KPIs, doing measurements on factors related to performance, impact, innovation, scoreboards, etc. So what can we learn from it? And what should we do different? What should we add maybe to measurement of frameworks and KPIs? Who wants to start?
I can start.
Okay.
So, in fact, as you know, we have various different indicators for various different purposes. So some indicators are on the systemic level. So, they just, their function is to assess healthcare systems as a whole systems. Then we have the level of organizations or sectors. Then you use also, of course, different types of indicators. And then finally, there are indicators on the patient's level. So then it can relate, for example, to patients' well-being or to patients' feedback about certain therapies, patients-related outcomes measures, for example. Recently, or just almost 6 months ago, right, Poland assumed its presidency, and of course, dedicated to certain priorities. And these priorities are related, for example, to security, also in the context of the health care. The most important topics are, for example, the transition of healthcare towards more digital systems, and then availability and access of medicines across all member states. And of course, all these goals are also subject to appropriate measures and monitoring. So just to give an example of 2 types of indicators which are commonly used within the European Commission. We have the European Innovation Scoreboard, and you assess, for example, R&D investments, public investments, private investments, the amount of patents, publications which are co-authored with partners from another member state. And we have also indicators which typically relate to performance assessments of healthcare systems across Europe. So these indicators are known as the European core healthcare indicators. And they assess, for example, healthcare systems across member states, disparities in therapies and treatments. They also evaluate socioeconomic conditions. And yeah, maybe I will stop here and give a chance for others.
Yeah, thank you very much, Natalia. So you gave a nice sort of a short overview of different indicators, different domains, and that now in the digital, we add some things on cybersecurity and safety, for example. So we assume that we collect these indicators, it provides us insights, probably with the idea to improve or do something different. We know something, okay, this is going well, this is going wrong, we should do something.
Can I
please,
go after what you said? Because actually when we ask our participants of our workshops, these were the coordinators of the Horizon Europe project, also in the field of the healthcare, medtech and biomed. So we had quite diverse group of scientists and project managers of the projects. Actually, they highlighted the inconsistency in the question of using the metrics, because actually what is measured very often within the European projects, it's not the outcome of the projects, but like outputs, yes? So number of the scientific publications, number of the patents that they produce. And the evaluators, despite the fact the evaluation process is getting more and more complex within the Horizon Europe projects, do not ask these questions related to the indexes that you mentioned. And we think that, at least that based on the opinion we received, that could be one of the areas to be discussed also in the context of the strategy to be implemented, how to measure it and to really apply the proper metrics for the projects that are funded, because at the end it should be long-term strategy that should be fulfilled by these projects. And what we see is like the very short approach. Sometimes it's like the one project phase, not looking further how to develop, exploit, and make the impact for the patients at the end.
So you advocate a sort of more long-term perspective on measurements and impact rather than only the output of the project itself.
Definitely.
Yeah, okay.
I am happy to bounce on that. I have another definition which is much simple, very simple, which is about having indicators on process or on results. And from the patient perspective, we like indicators on results, because what matters to us is not that we have nice innovation, but this is that they access the people who are there aimed at. And this is what we lack sometimes in two senses. First of all, we see quite many research programs where when you have done your article, you're done. But this is not enough. We like to wait for translational research. And the second thing is you succeed. For example, I have a very, it's painful to me. This is gene therapy for kids. It's a kind of disease. It was developed in Europe. And nowadays, in my country and in many other countries, when we have a patient like that, we have to send him or her to the US to be treated, when it was developed in Europe. So this is something that it's really painful, first of all, to bear with, but also to understand how public money has been invested there, and then it's not sustainable in the EU for many reasons. And when it comes to targeted therapies or innovative therapies, we have really this problem. And this means that we also have to address a lot of things, and especially because I am in the rare disease field as well, the cross-border. And I like that you have indicators that consider a cooperation between countries. But the fact also that not every country is able to offer the facility to give the medicine. For example, if I go to transplant or gene therapy, not every country has the facility, so cross-border should be really improved. And indicators on that may be very interesting. This is still about access. So I think we have many, and the last thing I wanted to address is coverage. And because, of course, we have nice medicine emerging, but at the end of the day, the patient can't access because they are not covered. And recently, just to give an example, because we speak of the US, but I have one patient from one country from the EU who need a transplant. The country doesn't want to pay for that. So this is not possible in the country, so the patient should have to move in another country where there is a cost. So the patient country doesn't want to pay. And so we are asked, as a patient organization, should we go to this trial that we have seen in China, or what else? Should we advocate? This is the kind of question you are asked nowadays. And China, they are doing well, and not only. When we go to CAR T cells or things like that, this is really an even application within the different countries and within the different fields.
Yeah, Martine, so you describe a very practical, let's say, issue related to innovation and not the accessibility to innovation. So what would be the implications for indicators? Should we measure things differently and report so that we can learn from it? What is your idea about this issue?
Yeah, I think that indicators maybe should be how an innovation goes to clinics. So that we have some kind of proof that the efforts that have been dispensed are effective on the ground and come to the patient and the physicians as well, because this is a burden for the physician as well, of course. Most of the time the physician come to us. So I think also this is really something that we need is about public and private cooperation, because we know that, well, from my knowledge at least, that the public is really good in innovation, but the private is very good in the access, because they work on that. So join the skills and the knowledge and the experiences would be something valuable from the money perspective, but also from the success. And we have other ideas, but I won't.
Yeah.
If I may build on that, I believe that private is very good in application because they are focused on application. And those are their indicators. And I strongly believe that it is not purely about the indicators, but what they cost. And it was not mentioned, but I'm not sure how it works in other European countries, but in Poland, those indicators mentioned are also the ground for the financing of the academia. So it is natural when I go, it happened many times, we wanted to start cooperation, and it was not the question about the impact on society, the question was about the number of publications we can generate with the project. And it should be kind of secondary indicator. Like, I'm not saying we should remove it because somehow we need to validate also the impact of the work for the scientific community. But the impact that current focus has, so the publication, the patents, everything what was mentioned for the academia is that we don't have really open science in Europe. And it is the huge struggle to really translate there is innovation into the application. And I will give you a very practical example. I recently started biotechnology studies in one of the top universities in Poland. And on the very first day of my studies, there was safety and intellectual property training. And the main message that I got with myself was that don't ever share your discovery unless you patent and you publish to anyone, to your colleague from your team. So if young students get this information already during their studies, how they can be open later when they do their work and if they want to cooperate with clinicians and so on. And it is really hard to overcome it. It is possible, and our example is that I want to believe they openly share the knowledge with each other. But it is something that requires building huge trust. The other thing with this indicators that I believe it is also kind of connected with the cultural things in Europe is that it creates a lot of hierarchy. And when we talk that our workforce is restricted, that we miss people in life science in Europe. And I can really see with my own eyes that when we have people in US, which are young researchers, they can run projects. In Europe, very often, you cannot do that. You need to have some mentorship of professor. And in one of my first trips to Boston, I've met Eric Minikal. I don't know if you know the story, but it is the guy in Broad Institute who 14 years ago just changed his career and started to studying biotechnology because his wife is in danger of prion disease. And after 14 years from just starting the studies, they have RNA therapy in clinical trials. And it is possible because in US they were able to get their own lab right after studies. In Europe, we have very talented young researchers. Young, I don't mean they just finished PhD. They are 5 years after with their PhD and so, and they cannot run their labs very often. So I believe that we also don't leverage the resources that we have and very smart people that are here.
That's a very interesting comment. So you indicate to this that indicators can and the related incentive can have adverse, perverse effects to behavior of organizations, researchers, etc. But also that we might look for other sort of characteristics which maybe can be used as an indicator. Young researchers.
So I won't be very original saying that I would look for, I don't know, number of clinical trials, maybe not necessarily the application in a context that the product is the patient, because clinical trials are difficult, and like I saw the statistics that 90% of them fail for many reasons. That's science, but definitely getting the innovation to the clinical trials should be kind of indicator. And there's actually, because you were asking also about the good examples in Europe, I think that for rare disease, actually, there is a very good example of the grant program. It is called Ardera. It is funded by European Commission, and it requires from the very beginning, from the consortium, that they have understanding of regulatory pathway and application, and that there is co-creation with patients as well. So you need to have, and also understanding of data management landscape. So everything that was mentioned today is required on the level of sharing the grant, simply, and I think it is the way how it should work, and they really require to show by the consortium that they know what they are doing in this wider perspective. And very often in the grant program, it is not required. And I think that somehow in this Ardera program, I see that they want to secure the application, and it is right way. Somehow they included the indicator of cooperation in the grant program, and it is kind of the indicator we should have in Europe to collaborate across countries and specializations.
Thank you very much. I come back to you, Martine. Natalia, you
yes,
already raised your hand in the...
Yeah, sure. Just coming back to your question, what could be improved, right? Or what could be, how certain indicators could be applied in a better way. So first of all, I would propose so-called SMART measures, where SMART stands for specific, measurable, achievable, relevant, and time-bound. And it's especially important also in the case where we deal with long-term projects, strategic projects. Then I would propose also to apply staggered, so-called staggered indicators. And in this way, we can divide very ambitious goals, which look sometimes that seem to be not achievable, into smaller partial goals and targets, which become more achievable. And one example could be, for example, vaccination, right? Vaccination rates, where the very ambitious European Commission goals are to get 80-90% of eligible populations to get vaccinated by certain year. So we know that there are already discrepancy between countries, and whereas, for example, some countries are almost there, other countries have really still quite some milestones
Bulgaria,
to achieve.
Romania.
So, for example, so if we could divide them, like I mentioned, maybe it could help. And another example, very briefly, so we have the European core health indicators, and they were in fact based on some Horizon projects, preliminary, for example, bridge projects. They were updated in 2017, and the last updates which I was able to trace were in 2021. But of course, we have to keep pace with technological innovation. So, for example, here I would also propose some modernization, incorporation, additional indicators, for example, for monitoring digital health adoption, for genetic methods, genetic medicine, better standardization, for example, patients-related outcomes. And sometimes we observe also some delays in collecting these indicators, like 1-2 years. So if we could connect these data to electronic health data space, also in the broader context of European data space, we could monitor these indicators on a real-life basis, real-time basis. And I think this could also facilitate certain activities and our conclusions and outcomes. Thank you.
Yeah, I could continue what actually was said here, because that was also the impression of the coordinators of the project, that currently the evaluation process is focused on excellence, which means that scientists put the novelty over the application to patients very often. And of course, this is the role, because they are scientists and they would like to, push this threshold farther and farther. But from the patient's perspective, it is not necessarily the best way to move forward, yes? So this is one aspect for sure that should be taken into consideration when we are thinking now about the next framework program, what Irene mentioned today in the morning, that now we're at this also specific times that there are already starting the discussions about 10th framework program, where maybe there is a time also to implement some digital evaluation tools, taking into consideration also this monitoring phases that will be carried out later on, including this patients-driven indicators and metrics. But also what coordinators suggested was maybe to think about composition of the projects that takes into consideration the synergy between the projects that were funded, for example, within one call, and alignment to this long-term strategies. How do they fulfill through the whole project pathway? So these are also some remarks that were already highlighted, and maybe it's good to be taken into account when preparing the next framework for the evaluation.
Really interesting. So I counter question. So I was raised in this excellence paradigm in the Netherlands. So we have now a generation from 25 years onwards who made a career. Everything they did was in this sort of way of thinking. They are now in the boards, managing research departments, etc. So do you think it's sufficient, thinking practically, if we develop these indicators? Is this sufficient, or do we add something to make the change a reality?
The metrics are not sufficient, for sure. And what was said actually, that in US, this tolerance for failure is much bigger. And if we don't change the mindset, also in this young generation of scientists, that they are starting their scientific careers, we will end up in 20 years with the same discussions. Yes, so here for sure, this is, and that was also raised, that this that people are afraid of the failures. And also when they write the project, and when they write it, they are very ambitious. But then when they execute it, then they realize that there is no space for failures there. And they prefer to do it in silos instead of trying to go out and search for the complementarities with other projects, because they perceive them very often as their competitors, which should not be the case according to this open science policy that should be implemented also within the European project. So I would say that the soft skills, and this is also interesting because many groups mentioned about the different workshop about the exploitation, that they would like to learn how to do it because they are scientists. And they said, we were not educated to do this application phase. So, or you give us someone that will help us to do that, or please educate us that we can do that on our own.
Very good. Martine, what's your take on this?
Yeah, I agree with that, of course. And also, I think that AI could be a very useful tool, especially because being able to address unstructured data. But I wanted to come back to the patients and also give another indicator that could be the place of the patient into the research. And there I have to say that there I am not happy with them at the moment, just because, no, I'm straightforward, I'm sorry, but this is the fact. At the moment, we are not considered as patients as partners. Why? We are not able to lead a work package. We have to be subcontractor, which is in a sense not so nice, but also this means that we have to pay your VAT bill, meaning when we get a budget, we have to withdraw the VAT. This is just finance, but this in Brussels, in Belgium, this is 21%. It's not nothing. So this is the first thing, and the other thing is that, for example, my patient organization is a global one. We are very committed in Europe. We do a lot of things, and we are the only specialist in our condition, and we are denied to take part to any ERDERA research project unless we want to volunteer for that, because we are funded by the industry for more than 50%. And I can't understand that, because if we are not funded by the industry, nobody else will fund us. We have no public funding at all. So there is something wrong there. And in addition to that, also, because prompts, for example, are really trendy, and I'm an advocate for that, patient self-reported outcomes or experiences. If you want to have a significant project with in the frame of a research program, and you have a ceiling for the funding for those who are eligible, not us, of 25K for 3 years, what do you do with that? I'm sorry. In addition to dissemination of research, which is what we are asked as well, for hiring people for trials and also dissemination, because this is part of research. And the physicians mostly say that we are very good at that, better than them, they say. So I wanted to say the place of the patient is really crucial, and we should be considered not as minors, but as real partners.
Yeah. So before we go to Kasia, one additional question is, so the Commission, the Health Commissioner, he cut budgets on NGOs. Many of the NGOs, whether they are more professional organizations or patient organizations, I think it's cut currently. So they're lacking funding. Do you think it's a public responsibility to support patient organizations, representatives, to do this type of things, other than also provide this outcome, let's say, data?
I am in a difficulty to answer that question because we have no public funding at all. On another hand, I think that public funding should always be linked to projects, because I think this is a way to achieve and to have results. So I don't know really about the reality of cutting funds for NGOs, honestly. But when we want to take part to a research program, we should be funded and also be accountable for the funding we got.
Right. Kasia.
So I will just answer also this question, because for me, the patient organizations should be funded by public for at least one reason, that public don't want us to be funded by the big corporations, because then always you will be skewed some way. But I wanted to build for the ERDERA, and I challenged this approach, exactly as you said, because in the official presentation there was no patient organization. Like, of course, you have no chance, most probably, to get a grant if the patient organization is the leader of the consortium. But that is another example of the beauty of having 27 countries in European Union, because the answer why they didn't fund it is not because the European Commission didn't want to. They've seen that the patient organizations should be the equal partner. It was questioned by the member countries, because on the member countries level, it is not everywhere possible that the patient organizations are funded in the projects like that. And for example, in Poland, actually, we can be the equal partner. So we have the...
But hospitals cannot be.
Hospitals also can
Not
be.
in the ERDERA.
Not all.
Mm-hmm. But we...
So that was the official answer.
Yeah. Very good. So I want to go to the last part. And so listening to the discussion, so we might add some things, we might do something in reporting. So Natalia, so how do we prevent or reduce bureaucracy and redundant sort of indicators and go more, which is more in line to a future vision on life sciences? How do we create impact, societal benefits, etc., economic benefits, in a way that it is also very lean and meaningful? What is your take on this?
Yeah, so already under the Polish presidency, the Polish presidency expressed commitments to improve regulations in terms of transparency, maybe the level, the burden of reporting, etc., etc. So these were words, and then activities came. So there are also some legislative instruments implemented. For example, the Small Business Act, which is especially relevant for startups, because the main principle is to take into account startups in practically in all regulations. Think about impact which certain regulations can have on small and medium-sized businesses. So it's called, this principle is called think first small. So I think it's already a very good start to proceed in this way, and this for sure will reduce and reduces already the burden, the administrative burden and overload of regulations, because these two aspects were mentioned already by small and medium-sized enterprises in multiple surveys issued by the European Commission.
So in the upcoming strategies and programs and project calls, we should look forward to these sort of examples where we can start with using this sort of indicators.
Yes, definitely.
Yeah, would it be realistic? What is the timeline in next year or so?
Well, I don't know all details, of course. So I don't know. Maybe my colleagues can support me with these informations. But I know that the proposal has been already that the European Commission has already proposed these legislative instruments. So, of course, you know, the procedures are that the European Commission proposes certain activities, legislative and non-legislative, then it goes to co-legislators, so namely the European Parliament, and then to the Council. Then the feedback goes back again to the Commission. So, I mean, this is how it works. So these steps cannot be omitted. because yeah, all sides have something to comment on, right?
Absolutely. So we're almost at the end of our discussion. So can I ask shortly a reaction, a message on the indicators, how we should move forward for the next years to make it more impactful and relevant?
Yeah, I think that the EU has a system that protects the users and the patients, which we don't want to jeopardize. But it's not designed for innovation, so there we have to set some kind of objective and the indicators that go with, and we have mentioned some, to achieve this goal. And I think that we have quite some example with sandboxes, for example, in some kind of medicine or all, especially for very rare diseases that can be very interesting. So yeah, let's keep hopeful, and I think we have tracks. And this is what we hear. The willingness is here, the consensus almost. And now this is how and when.
Okay, Kośla.
So from my perspective, definitely the indicators that support patient outcomes and which speed up the processes. So for sure, ensuring open science and collaboration, the indicators should support it.
Thank you, Natalia.
I would say, yeah, just keep it simple and consistent, and keep the feedback loop up to date.
Thank you. And last one.
In addition to all what was said, actually, what I would add would be the non-prescriptive, but more open to development, and for sure synergize and align the projects that are granted, so to make the best out of money that were already invested in the project.
Thank you so much. And I also like this idea of that this sort of interaction also with the reviewers. For example, that's not a final judgment and that you should be afraid of presenting your results and maybe some failures. But it's a sort of dialogue, an ongoing dialogue for improvement. So please a warm applause for our excellent panel, and thank you so much. And we will provide a summary tomorrow morning, also with the other sessions.